Hello, I'm Ryan Liberty, and in this video I'm going to answer the question, what are trauma and stressor-related disorders? They don't sound good, but let's find out. Alright, so let's get ready to discuss what are trauma and stressor-related disorders. Before I get to that, I just have a little blurb that I have to do here, which is to remind you that these are not diagnostic criteria. These are just short descriptions of these disorders, so these should not be used to diagnose you or somebody else. If you need a diagnosis, you'll have to go to a trained therapist or a trained professional who's able to do that for you. And also, these are just labels. They're meant to point you towards a pattern of something that may be happening in your life or something that you or a loved one is experiencing. But if that label for any reason causes you stress, if it doesn't aid in your healing, you can let the label go. Again, it's just to point you towards something so that you have an idea for what's going on. So with that said, I've always got my notes here to keep me on track and make sure I'm giving you good information. So let's get into what are trauma and stressor-related disorders. Well, first, they revolve around the feeling of trauma and stress. I do have a video on trauma, so check that out if you haven't already. And they are patterns that interrupt in our daily functioning. So that's the basis for what these all revolve around. Let's get into what they are. So you have reactive attachment disorder, and this is a childhood trauma disorder, so you won't see this in adults. It is where a child is emotionally withdrawn from their caregivers, and they lack a responsiveness and they lack a positive affection towards the caregivers. So they're generally kind of dry and flat around caregivers, but they'll also they'll react out of proportion and may be frightened by people who are not their caregivers. This also shows up only when there's extremes of insufficient care in their life. Maybe they move from one home to another. Maybe if there was a neglectful parent or an abusive parent in the household. For whatever reason, this child wasn't able to be cared for properly. And that's one of the reasons why you'll see reactive attachment disorder. Moving on, we have disinhibited, I can't even say the word, disinhibited social engagement disorder. This is also a childhood disorder. It is where children will act like they know a stranger. So if a stranger comes up to them, they'll act like they know them already. They'll be very trusting and willing to go off with the stranger if that was something the stranger asked them to do. And there's an absence of looking back towards a caregiver and checking with the caregiver to make sure that things are okay. And again, this is something that happens when there are extremes of not having good care in the child's life for one reason or another. So this is a childhood disorder. You won't see this in adults, but it's, again, something to be aware of. So the next one is a big one. It's post-traumatic stress disorder, which is also known as PTSD. PTSD in general is exposure to an actual or a threatened traumatic event. It involves things like distressing memories and emotional flashbacks where you re-experience this traumatic event that has happened to you over and over and over again. Not necessarily directly, but you experience the feelings in your body, the thoughts and the emotions and everything that come with it. It's a very broad topic, so I'm going to make another video on that, so stay tuned and check out for that one. But PTSD is more than what we typically think of as just like the veteran coming home from war. That is certainly a part of it, but it affects many, many people, so be aware. Acute stress disorder is the same as PTSD. PTSD has to last for more than 1 month. Acute distress disorder is the same symptoms, but something that only happens within a month. So something like when you get into a car accident and for 1 month you have these flashbacks and these emotional, intense reactions to that event. As long as it's only lasting for 1 month, then you get acute stress disorder as a diagnosis. You also have adjustment disorders, which are when you have a distress that's out of proportion to an identifiable stressor. So sometimes in something like PTSD or acute stress disorder, it's harder to figure out exactly what set off these extreme emotions that you're feeling. But with an adjustment disorder, you know exactly what it was. Maybe it was a really difficult move in your life. Maybe you got fired or there was a big breakup. It's something that happens within 3 months of that event, lasting for no longer than 6 months. And it's also not the normal bereavement process of losing a loved one. So that would be considered adjustment disorder. And then we also have other specified trauma and stressor-related disorders, which is basically when you're experiencing symptoms of any of these disorders, but you don't fit the criteria of any of them fully. But there is an impairment in the social or occupational or other important areas of your life. So you would get other specified trauma and stressor-related disorder in that case. And we also have unspecified trauma and stressor-related disorder, which is basically when you don't have, the person who is diagnosing you doesn't have enough information to give you a diagnosis, typically in like an emergency room setting. So they just quickly give you this unspecified trauma and stressor-related disorder, just so people have an awareness of what you're going through in general. So those are the trauma and stressor-related disorders. I hope that if you or somebody else is experiencing them, that this has helped you to get a little bit of a framework to understand what you're dealing with. I wish you much love if you or somebody that you know is going through these, and I'm glad that you took the time to get to know this information. Thank you for watching. Hey, it's Ryan Liberty. If you like that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.